today we are doing PRP for hair restoration. So I have already drawn my patient's blood, spun it down, and I have millions and millions of platelets in these 3 little syringes. And what we're going to do is we're going to inject them, and over time, her platelets are going to signal to her stem cells to migrate to where they are, and they are going to help the hair follicles not die. They're going to help bring them back to life. So it is a great procedure, especially for women and men, but lots of times women need 1 or 2 treatments where men may need 3 or 4 treatments. So women are very responsive to this treatment. So I have already sprayed down our patient's scalp, and I'm going to go ahead and start just injecting the PRP. Are you ready? Mm-hmm. Now, numbing wise, we're using this Zimmer because it's like ice. And you could use lidocaine, but I'd have to inject her 100 times with lidocaine, and people generally still have some kind of sensation, so we might as well use ice and just follow me along, okay? All right, so I'm going to start all the way over here. Mm-hmm. Here we go, 1, 2, 3. And just little dollops of PRP along the way. And we already discussed the areas that she is feeling the loss, especially right up in here. But we're going to keep on going back now. Here we go. And so it is really important to make sure that you have a healthy inside when you're doing a procedure like this, meaning make sure your hormones are checked, you're using vitamins that contain biotin, things like that to help support what we're doing on the outside. It all works synergistically. So when we do PRP, I always give my patients a shampoo to help keep their scalp nice and healthy. And then we obviously do the PRP procedure. And then we're going to do microneedling after this. So we're going to microneedle in the PPP. The platelet rich plasma. You're doing all right? Mm-hmm. She's a trooper. Often talk about PRP like gardening because the shampoo I consider getting her soil ready or her scalp ready. The PRP that I'm doing right now is like planting seeds. The microneedling that we'll do next is the microneedling is like the rototilling, and then we're going to use a serum, which is like a fertilizer. And then she has a laser cap that she's going to use every other day for about 20 minutes as her greenhouse. So all of these things together work very well. You can find places, med spas that do this procedure, but I don't know many that do all 5 components of it. Now we're going to go over here. Ready? Here we go. Also, another important aspect of PRP is what kind of centrifuge is being used. If it's a double spin or a single spin centrifuge. So we have a double spin centrifuge, which helps to concentrate those platelets even more. So we want the most number of platelets that we can possibly get out of your blood. And you do that by double spinning. Sometimes people come to me and say, I don't know if I want to do this because I've gone other places and I've only I haven't seen much result. But my question back would be, what kind of centrifuge did they do? And did they do a full 5-step procedure? Most of the time the answer is, oh no, they just use one part or another. So, if you watch any of my videos, you know I'm a big proponent of adding things together. Because you'll get a better result when you do that. Sort of like going to the gym, you still want to do the diet too. Everybody is a candidate for PRP for your hair. Lots of times women, we kind of get passed over. I mean, you can see she's got lots of long hair. And people go, oh, why would you need PRP? Well, women can have hair loss just as much as men. And it may be not as noticeable, but maybe their ponytail is a little bit smaller. Maybe they're seeing, a lot of hair come out in the shower. So And for me especially, my hair is a lot. My hair is a lot of my, I don't know if it's my personality or part of me, just like it is part of everybody. And so it can be very important to people in general. And I think when you have hair loss, I think it really does decrease your confidence in yourself. So there are treatments. You don't have to undergo surgery. Okay, I'm going to have you turn even farther this way. Okay, and we're almost done, okay? So I know you said this part, this way. I want to do a little bit farther back because you have some hair loss back in here. Okay. So we left off about here. And almost done, okay? Mm-hmm. She is a trooper. I recommend multiple treatments. I think when you get to the point where you're noticing your hair loss, you should do multiple treatments. So I usually recommend 3 spaced every other month. And then of course doing all those other things like the oral supplements, obviously the shampoo and the laser cap along the way too. And then maintenance wise, I usually recommend once a year. Just one treatment. Because we all have stresses that sometimes can lead to a little bit more hair loss throughout the year. So we're done with that part. We're done with all the poking part. Are you okay? Mm-hmm. Okay. So the next step is we're going to take our platelet poor plasma. This is a leftover serum. I'm going to just kind of put, or try not to. So we're just going to work it in here. There we go. So now we've got our microneedling device. And it's going to feel like a vibration. Mm-hmm. There we go. All right, so I'm going to start way over here. There we go. All right? Mm-hmm. Okay. So this helps to stimulate your hair follicles in and of itself. So it's really just stimulating those follicles, that's all. That's a lot, but, and then getting some of that PPP down there. Almost there, you're so good. And that's really it. Oh, so simple, easy, PRP. If you want to learn more about PRP for hair restoration, find us online at RejuvenationMD.com.